Welcome back to another episode of Ask the Doctor with Dr. Jeffrey Sherman. Today, we have an important episode about COVID and cancer and how cancer patients can safely get the treatment that they need and also the symptoms for cancers. As of July the 9th, there are 3,047,000 cases of COVID-19 in the United States and 132,000 deaths. So our numbers are increasing dramatically right now. Welcome, Dr. Sherman, to the show.
Thank you. Good to see you again. Thank you for having me.
And so the point of the show, of course, is kind of similar to how we can't ignore our other symptoms in this COVID world. We can't actively avoid the hospital because of fear of COVID, because some hospitals separate stuff. So how is there anything special that a cancer patient should do?
Well, I mean, there's the cancer patients who have already been diagnosed and are in the midst of treatment or have had treatment in the past. There's the rest of us that are trying to avoid it and screening for it. But the actual cancer patients need to be, aware of their usual symptoms of their treatment, the radiation, the chemo, the after effects of those, and know and be able to be in tune with their body, which they probably are, of the typical way they feel, the symptoms that the radiation may have left them with, and anything new that can come on possibly as a result of COVID. Cancer patients, especially in the, can be tricky because in the, early onset of treatment or at any time, they can be susceptible to infections. Their fevers can go up and they could exhibit some of the COVID symptoms, but it's their, they're exhibiting their treatment symptoms, but it overlaps with COVID. So they got to kind of be alert about any subtle changes or just general awareness.
Exactly, because
body symptoms.
There's things like lung cancer.
Right,
and lung cancer, of course, you
can have some shortness of breath, difficulty breathing. The treatment from that, because you go in radiation, and some patients have had surgeries, part of their lung removed or an entire lung removed, so their oxygenation isn't that great to begin with. So they may, exhibit, the symptoms of COVID may just overlap the symptoms they're already experiencing just based on their treatment. So they just got to be, and the lung is a good example because a lot of COVID symptoms head for the lung right away. The shortness of breath being the primary one.
Exactly, and I think that's the biggest danger with cancer patients, is just that their bodies are a lot more susceptible to COVID-19 than non-cancer patients, and so I guess that reiterates the importance of social distancing, because you do not want to unwittingly transmit a virus to a potential cancer patient or to somebody who will see a cancer patient.
Yeah, those patients should be, social distancing tremendously, being at home. If they must go out for treatment, of course, be very, very careful with the mask or even an N95 mask. What makes some cancer patients more susceptible than others, or them as a group susceptible, is their ability to fight off infection. Sometimes the chemo can affect their white blood cells, their infection fighting cells. They're not able to make a accurate immune response. So if the virus encounters their anywhere, and then they can't mount a good immune response, the virus can maybe take over their body pretty aggressively. So their immune systems are compromised just by definition, the cancer itself and sometimes the chemo treatment they're undergoing.
Now, because COVID-19 does some of its damage through the cytokine storm, does that mean there's potentially like it's potentially not as bad for a cancer patient to get it as like some other bacterial infection?
Right, the cytokine storm is like an over-aggressive immune system, which the cancer patient does not have.
Right.
So you have the cytokine storm, which is like an immune reaction to the virus and affecting your lungs and causing inflammation there. In the cancer patient, it would just be overrun with the virus itself,
Right.
and supportive care would have to be initiated because they don't. It's not the cytokines that are causing the inflammation; it's the virus doing it. Without an adequate immune response, the virus doesn't have a whole lot of opposition, and so the virus is free to duplicate and grow in the lung, causing the difficult gas
Yeah.
exchange and so on. And then you have to just support the cancer patient, and hopefully they won't have to go into
Exactly.
ICU or a ventilator type situation.
Let's see. So because overlapping symptoms can exist, like in lung cancer because of coughing, I think I believe it's possible that someone could have developing lung cancer that they don't know about, and they could have had like a chronic cough until like throughout this pandemic. And once
Right.
they actually get COVID and actually are expressing coughs of COVID, they might not realize it, and that could be a big big issue.
Right. I mean, you got to just pay attention to everyday things, and just because you have cough or fever or something doesn't mean it's COVID. There's other things going on, and then you can just discover other problems. Your typical pneumonia, your bacterial pneumonias without COVID negative bacterial pneumonias, pleural effusions, fluid in the lungs, and the congestive heart failure patients, which then can turn into cough and shortness of breath. The just the generic dry cough, asthma
Exactly.
exacerbation. So there's a lot of disease symptoms, and I guess certain things can be discovered. Lung cancer being one of them, in terms of a new cough. You want to rule out COVID, but it can lead to other diagnoses.
Exactly.
Uh, and cough, not the most typical presentation of lung cancer, but still possible.
Right. Um, I think this brings up again like the importance of not ignoring your symptoms, I guess, because telemedicine exists, right? That was how we started the show, actually, talking about how people should be talking to their doctors via the phone or via video communication. But right now, though, do patients actually have to use their phones?
I'm sorry, you broke up. What was that one?
Do patients actually have to use telemedicine right now?
It's their call. It depends on their comfort level.
Okay.
They can come into the office. I argue our office in general, everybody's office, are very, very safe places. The way we scrub things down, the way we stagger office visits, the way everybody's wearing a mask around here, and like I said, we disinfect every common space, and we have an air filter in the waiting room. So all these things are safe, more so than what the general public may be doing out there in in the streets. But if a patient's still uncomfortable coming into the office, the telemedicine is a excellent alternative. No, you're not getting that physical exam, but you're getting a good half an hour
Yeah.
face to face with the patient, understanding their symptoms pretty well by seeing them. They're able to point things out on their body. You can read their body language and just see how they're doing generally. So it's a valuable tool.
Exactly. And I bet that you can probably visit a doctor via telemedicine and then decide in that appointment whether you should go see the doctor directly for if it's some kind of physical examination.
Yeah, for the follow ups, or for, hey, yeah, it sounds like this. Maybe in a few, let's try this. plan in a few days. If you're not better, come on in. We can do an exam. We can kind of make that exam count for, see how you were then and now. So you want to be careful about maybe not having those cancer patients come in necessarily.
Right.
But it all depends on where they are in their, spectrum of treatment. Yeah, you got the breast cancer patient who had it 5-6 years ago. She's to be in the clear. You got a newly diagnosed breast cancer patient, maybe not want to go anywhere. But my point is, still do the preventative medicine stuff. You get your mammograms and colonoscopies and going for routine blood tests and screenings because, if you skip one, it's possible something can
Right.
sneak up.
And that's the whole danger with cancer, because it's such a slow creeping disease that if you miss or ignore the early signs, you could potentially have a much worse condition on your hands.
Right, and some are not so slow.
Right,
but
some are not.
But that's
All right, looks like
can you see? Sorry about that.
that's okay. All right, you're back now. We have a question from the chat. With patients that have autoimmune diseases and are on Rituxan, which destroys
Rituxan,
B
yeah.
cells, for example, would that also be somewhat an advantage because their immune system is fried due to medications?
Well, it's an advantage against that cytokine storm, absolutely. So you're not going to get that. You're at a disadvantage of what the virus may do if it hits you. You're at no advantage of contracting it. You still got a social distance just like everybody else. But Rituxan is a chemo agent, and it can lower the immune system. So I'm not so sure it's so protective in that regard. It does seem like patients could be a little susceptible in that case, along with any chemo agent, oral or IV. I think they're both equally important to group all together in terms of immune system vulnerability.
And it's like what you said before, that even if parts of the immune system are like turned down, which would have caused damage to your own body, it would still let the virus roam free, I suppose.
Yeah.
Yeah, and if the virus roams free,
the police department for the virus is a little bit out of it, and not enough to apprehend them all. So they roam free, and then eventually, hopefully, you get enough to cover it, or it's you don't, and the patient.
Exactly. Let's see. Right. Do you know if there's any do we know if there's any cancers that could arise from the quarantine lifestyle?
Not directly, to my knowledge. I mean, you can kind of think about it, though. I mean, if you wanted to,
lack of exercise, not seeing the sun.
You're getting into more internal medicine things as opposed to cancer. Lack of exercise, a little bit of a cardiovascular thing, lack of fresh air, some pulmonary things, lack of moving around, sedentary lifestyle, some blood clots, or just congestive heart failures and things like that. If staying at home has led to people smoking more in the back, or certainly drinking more, to lead to some liver issues, but
Uh,
it hasn't been a long enough time in terms of the quarantine to look in terms of like an association between that and cancer incidents of any kind. But other internal medicine things for sure, and mental health, like we talked last week, for sure.
yep. So like if because the internal lifestyle mostly the quarantine lifestyle mostly affects what you were saying about internal medicine. Um, I guess it would be possible for someone to like maybe be worried that they have cancer when they have a different symptom, but I guess that can just be resolved by the whole telemedicine thing, being able to communicate with a doctor about it.
Yeah, and ultimately, diagnosis will be needed made, imaging or whatever. I mean, if there's a new onset of a pain or a funny new symptom that's not going away, I mean, you can try medicine X or Y over the phone and over the video conference. But if things aren't improving and the patient's symptoms are persistent, we need to image things, CT scans, X-rays, certain, you know, directed toward the particular symptom, because cancer is, at the end of the day, all the symptoms in the world you can suspect it, but unless you see it on an image, on
Exactly.
a CT or on a scope of some sort, or then that's how it's ultimately diagnosed. Then you get the tissue, and then you get the type of cancer it is. So you need to see you need the images. If a cough's not going away, you get a chest CT. If your abdominal pain's not going away, you get your abdominal CT. If
Exactly.
you're showing some particular pains or signs or symptoms, you get those studies, and then you got to find and if that's yeah. I guess the take home message is, as we've been reiterating the entire few weeks, is regular medical problems don't go away just because COVID is at the forefront. And if you think you've got a new onset abdominal pain, get in there and get it checked out, or do a telemedicine visit and get it checked out, because not everything is those symptoms can't be ignored, and other medical problems don't care if COVID's going around getting all the attention. Those other medical problems are going to still be out there.
So on the subject of getting things checked out, when when somebody's going to the hospital, they is there anything special that a specifically cancer type visit person should prepare for?
Just you got to express the fact that that's in your history. Cancer patients, and especially recently diagnosed or recently treated, are isolated. They're put in separate rooms. There's special parts of emergency departments, special hospital floors for them. Just be very clear about diagnosis, time frame, particular treatments, because they're triaged differently. When you get to the ER, cancer patients, everybody goes one way, cancer patients go the other, and they
Okay.
have a separate, protocols and precautions to take with those patients. And just know your symptom set, know your body, know the time frame and which the dates and the types of and the cycles of chemo. You got to be educated so you
Hmm.
can get the best care based on your presentation.
Yeah, that's a good point. Um, let's see. So just because you specialize in the digestive tract,
Yeah.
I would like to ask about the symptoms and preparations for various digestive cancers, such as the colon.
Yeah. The tough thing about colon cancer is it's not always symptomatic. That's why we do
Really?
colonoscopy. And,
Of
yeah.
course.
But uh, uh, change in bowel habits would be the number one thing. You're used to go every day, no problem, like clockwork. Now either you're skipping a day or two, and there's something going on, and you're having some discomfort as a result of that. Or on the other flip side, you may be going more frequently, and looser stool more often. So there's a change from your a day, you were good, to your 3-4 times a day, or one every 2 or 3 days. With some abdominal pain when you have a bowel movement, that can be another symptom to pay attention to. An easy one to pick up on is blood. If you see some blood in there, that's a
Yeah,
red
blood.
flag, no pun intended. Just get that checked out. But in terms of symptoms, pain, cramps, change in bowel habits, that's the
Exactly.
number one thing that you can pick up on. That's different. That's different. And then there's the asymptomatic ones. You do a colonoscopy on someone, they feel great, but up there you see a tumor. I mean, geez.
Yeah, I mean
Tough one.
that's why imaging is done regularly after a certain age.
Yeah.
Um,
Yeah. Other
Are-
abdominal cancers, pancreatic cancer, that one's a tough one. That one doesn't get symptomatic until, I'm sorry, it doesn't get symptomatic until it's really too far down the road. That's more of an abdominal pain right up in between the ribs, up in the high rib cage area where the pancreas is.
Okay.
Pancreatic cancer goes asymptomatic for years and years.
Wow.
Maybe a little diarrhea, but that's non-specific diarrhea. You just because you have diarrhea doesn't mean you jump to pancreatic cancer diagnosis. So that's a tough one. There's not really a good screening tool either. It's not common enough to
No.
screen everybody with a
You
CAT
can't-
scan.
Um,
Necessarily, you can get some blood work, but it's hit and miss in terms of a screening tool.
yeah, I was just about to ask about measuring insulin in your blood or the other molecule.
Yeah, it doesn't necessarily relate to pancreas. It just means how your body reacts to insulin resistance. Diabetic patients, but in terms of pancreatic cancer, those are some and symptoms
Yeah.
of that come on when it's spread. Plus, you might get a little jaundiced, yellow eyes, yellow skin. That means the head of the pancreas, the mass in the head of the pancreas, is pinching the bile ducts, and you're
Oh no.
biles. And so by then, things are, you're in trouble.
Yeah.
Those are the two main cancers. Stomach cancer, and a lot of these GI cancers are, blood work related. Anemia is a tip off. Low red blood cell count, a certain type of low red blood cell count, what we call a microcytic anemia.
Ooh.
The red blood cells are small. They're fewer and small. And those are indicative of blood loss, which a stomach or esophageal cancer can represent as. Of course, esophageal cancer also has the potential for what we call dysphagia or trouble swallowing. You swallow your dinner, you take a bite of dinner and it gets stuck. Just because something gets stuck doesn't automatically mean you have esophageal cancer, but
Okay.
that's a symptom of that. Sometimes, though, that grows without symptoms either. So you just got to,
Exactly.
go for your regular checkups, get those blood tests checked, and be in tune with your symptoms.
Now, how is throat cancer?
That would be a trouble swallowing too. That would be a constant clearing of the throat. That would be some coughing up blood, things like that. That's more of an ENT scoped out. That's an ENT or a diagnosis with either a scope through the nose, or more likely a neck CAT scan can diagnose a mass in the neck. Your pain, trouble swallowing, and changes in the voice, changing in saliva too. Dry mouth can do it. So
Saliva changes.
usually that's more of a sore throat, trouble swallowing. If there's going to be a space occupying lesion up top, the swallowing is going to be, that's a sensitive, that'll be something you can pick up on.
So stomach cancer, could the risk of stomach cancer be increased at all for someone who has gotten ulcers in the past?
Ulcers from
what matter?
ulcers, not so much. If you had an ulcer from H. pylori bacteria, or you just have had it because of too much acid, or you've had it from medications, You correct the ulcer, you heal them. It should be no risk of stomach cancer. Patients
Okay.
with stomach cancer develop ulcers as a result of the cancer,
Oh,
but just the history of peptic ulcer disease does not, over time, result in an increased risk of stomach
right.
cancer. Um, Esophageal cancer is a little bit different. Increased acid reflux and esophageal ulcers and changes from acid reflux do indicate an increased risk of esophageal cancer down the road. That's why we follow up the endoscopies on patients with esophagitis and esophageal ulcers at a much tighter schedule than we would on patients with ulcers from other parts of the anatomy up there. So we want to be aware of esophagitis, esophageal ulcers, and potential precancerous cell changes, something called Barrett's esophagus, something that can happen in a patient with ongoing acid reflux over the years.
Exactly. So we do know that COVID seems to cause, no, definitely, the COVID causes issues in various parts of the body, including the digestive tract, just because it seems to affect the blood. That I think that could that mean that patients with cancers in other parts of their body could get basically just get a lot worse because COVID is affecting that part of the body as well?
And even in non-cancer patients, I mean, you know,
Yeah,
um, exactly. I mean, you cancer patients are set up lung cancer or GI cancer, um, are COVID, as we know, in some patients are the patients are just, well, they recover and they're okay and they're out and about. They're just not the same. They may not have as much wind. They become a little short of breath sooner. And if it's a cancer patient, it's even that much more problematic in the long term sequela. I'm also
exactly.
thinking that there's maybe not a colitis, but there may be a long term post COVID IBS coming up that we're going to have to deal with. And I suspect that colon cancer or general IBS patients are going to have a tougher time
Exactly.
dealing with that. Those who have had post COVID symptoms, have had COVID, gotten over it, and now are maybe a setup for some more likely IBS type symptoms. So there's that going on, and just having the history of cancer complicates it that much more. So it's a tough, it's another reason to really want to social distance and stay out of the
Exactly.
hospital, stay harm's
COVID.
way.
Yeah, COVID is a really scary disease, not just because of the short-term effects, but it causes a bunch of long-term health effects for the person forever, and as far as we know.
As far as
And
we know, we got to assume that hasn't been a ton of time,
exactly,
but we got to assume that, and hopefully we can help those patients down the line. We can help the patients in the near
exactly.
future and in the long run.
There's probably going to be an increased demand for chronic illness care, even more so than there already is.
Yeah,
And
we don't know what the need for home oxygen is going to be down the road, or
exactly,
you know, or just other supplements to promote good lung function or GI function.
and I want to let's see before we start ending off, Sherman. Is there anything that you wanted to talk about?
No, I just want to reiterate for
Yeah,
for the patients out there, for everybody to wear their masks, to keep the distance, wash hands, but wearing the mask is key. I mean, it's not that big a deal. I know there's a lot of folks out there who are a little defiant about it, but I would just implore you to do so. The more we wear masks now, the quicker we can take them off down the road. They won't be with us for very long if we can all wear them. And that's really, I
exactly,
just want to just be smart out there, and and don't take it for granted, and don't think, oh, it's not going to happen to me, because it very well could.
exactly. Yeah, that kind of attitude is exactly what makes things worse for the individual, really, because you're getting rid of precautions that otherwise would make you okay.
Yeah. Yeah, if we could
Um,
all obey all the same rules, we could get out of this much quicker and safer. You just have a percentage of folks who are a little bit like I said, defiant or stubborn or whatever the word may be, and that's what's kind of keeping this lingering longer than it needs to be. And it's not even lingering now; it's kind of shooting
Yeah,
up. I think
it's
those
accelerating.
for those reasons, you know.
In fact, medical offices might close down again like they did in the spring. So I guess it might be important to uh, get anything done that has to be done in a hospital now, or would it be better to wait?
No, I would get it done now.
Yeah,
It's as safe as possible. Fewer patients maybe going out now. I still think there's going to be a big rush down the road. So now, while it may seem that there's a more virus out there, if you take the precautions, as I said before, the doctors' offices are generally a safe place, and the operating rooms
exactly.
are safe places. So it's
Yeah.
it's take care of it. Take care of those.
Doctors, I always like to think about earlier, even in the pandemic, how doctors know exactly how bad this is because they get to see what's going on. So
Right.
I always like to think that if the doctor is taking these precautions, then everybody should be taking those precautions. And so doctors' offices are going to be the cleanest because they clean
Yeah.
stuff.
Clean,
Exactly.
scrubbed, mopped. The cleaning crew comes in every night. The chairs are sprayed down. The examining table is sprayed down, disinfected. The whole thing.
So before we end off our show, we would just like to again reiterate to wear those masks because it defends everyone around you, which in turn makes the entire pandemic go by quicker because we're able to have a lot less damage done to everybody involved.
Right.
And make sure that you, of course, wash your hands. You social distance because you never know whether you or someone else might have it, even if you don't have any symptoms. Then you could transmit it to patients, or not patients, just people who are at higher risk, such as people with cancer, who you may or might not even know have cancer.
Right.
And it's important for those cancer patients or people who might suspect they have it to pay attention to their symptoms acutely and contact their doctors as soon as they can in case something seems to go awry.
Well
Right.
said. Exactly. Just stay in tune with your body and monitor all changes of your own of your body symptoms, new onset things, and don't ignore things just because there's a COVID out there. You take the right precautions. You go to the hospital, they'll protect you, and you'll get the more acute medical attention you need.
Exactly. Before we end off, if you'd like to make a private appointment with Dr. Sherman, you can email the link in the chat, towergastro@gmail.com, to set up an appointment. And this episode of Dr. Jeffrey Sherman with Ask the Doctor has been good. We do this every Thursday at 3 p.m. So see you next week. Stay safe.